And hello, everybody. We are live.
3, 2, 1.
Roll.
What's happening, Dr. Scott? Good to see you today.
Good to see you too, Fulton.
Absolutely. Thanks for having me.
We got Martin with us today.
Good afternoon, everybody.
Our guest
Martin,
of honor.
welcome.
Martin's a patient at Advanced Medical.
8 days now.
Okay.
8 days new. I met Martin. We did dinner. We went to dinner, what, probably 2 weeks ago?
Yeah, something like that.
Went to dinner, met Martin and his wife.
My bride came with us.
Nice.
Met them, found out they had some knee issues.
Yes.
And 8 days now.
8 days, gospel truth, no pain.
Here's a question.
Spooky.
How did he know
How did he know what, Rick?
to call you?
How'd you know? How did we meet up?
That's a very good question.
I invited him to dinner.
My bride saw something advertised,
Yes.
and she said, hey, we should check this out. I said, I'm not a big dinner person. She goes, it's for our knees, because I'm getting old, and she'll kill me for saying this, 8 years older than me.
Okay.
And so her knees are hurting. She's bone on bone.
Okay.
So, man, next thing I know, I'm going to dinner.
Okay.
And there's about 20 people there, something like that. And I hear Dr. Scott talking, I'm just listening. And I'll tell you the trick that got my light bulb to go on.
Yes.
He said, how do you value your life? And
Great question.
I was thinking about buying a sports car this December for my birthday.
Okay.
I was going to spend like $29,000. And then he's talking about value, and I'm like, oh, boy, I think maybe I better get my knees done first so I can get into the sports car.
Isn't
What
that
kind of
the
car?
truth?
What kind of car are you thinking
There's going to
about?
be I'm going to buy a 99 Firebird Trans Am Daytona series. They only made like 1,200 of them.
What color is that one?
They're
I know
all
exactly
white.
what you're talking
Yeah,
about.
they're all white with the Daytona decals and everything, the badging.
Ooh.
How many
they're kinda
horsepower?
They're back in those days. No, that horsepower maybe 300,
300. Yeah.
280, 300. I'm
That's
not buying
cool.
it for speed. I'm buying it to take my wife to get ice cream on Sunday.
Cruise. Absolutely. So is it already, is it built out, or do you have to, is it a hobby for you to work on it?
No. I don't work on it. I don't
Okay.
break knuckles and
I got you.
This is strictly turn it on and go.
Yes. Okay.
Turnkey.
Yes, turnkey.
Hey, pretty much getting those knees, it's almost like a turnkey.
It was. I
Pretty
have
fast.
to tell you, Doctor, I tell everybody, we have maybe 6 more people coming to this guy because it's like magic. I mean, I know it sounds silly. My wife's still a little sore. She had both knees done.
Okay.
But I will tell you this. I made a note of this if I got time. I'm white coat phobia. That
Okay.
means we hate
Yes.
needles since birth. Well, when they told me they're going to put needles in my knee and then take blood out of me, I'm like, and they call me Thumper because I'm thumping like this, nervous wreck. Well, what's the guy's name that does the injections? Jeremy?
Yep, Jeremy.
I'm telling you, Jeremy, if you're listening, he says, trust me, I do this all the time. They put this like icy spray on you.
Yep.
Puts the needle, and I don't even feel it.
Nothing to
I'm
it.
so embarrassed. Like, all that thumping for nothing. And then I got to go next week, which was yesterday. They're going to take blood out of my arm,
Yes.
spin it with the Black & Decker, and then come back and put it in my knee
Yes.
with another injection.
Yes.
I'm like, oh, I couldn't sleep last night. I go there, piece of cake, take the blood, you wait, whatever it is, 10 minutes, put that needle back in your knee. The guy's good. Jeremy is
The
good.
guy's good.
Yeah.
He's an expert at regenerative medicine.
He's very kind. I was telling the doctor and my oldest brother, Jeremy's got a kindness to him. Like, he's just gentle. He's not rough on you.
This is the same guy we just got through talking about. That I was
Yes.
telling you about.
Yes.
He is hilarious. He's funny. He's hilarious. He's an expert. And get this, he plays the saxophone.
He asked me about that. He wants to
Wow.
play in our church.
Oh.
'Cause I go to
yes.
Ocean View Baptist, and I said,
Yes.
hey, let me make some calls, because they got a
That's
lot of
awesome.
musicians. So
That's
that'd be a
fantastic.
good connection.
He's got a lot of skills. He's an expert.
Yep.
He's an expert. And you say you didn't feel anything?
Gospel truth, fellas. And I'm a real cupcake when it comes to needles.
Okay.
And he's got that touch. He'll talk to you, and bam, he sticks that thing in, and that was it
That's
for me.
awesome.
to me.
You know, it's interesting you say that because we sat here last week and we went through the process of somebody who has a knee replacement, okay?
Ooh.
We talk about the pain, we talk about the downtime, we talk about the opioids, and you sit here with us today and you explain just how simple this injection or, you know, and to point something else out that you said that I want to make clear for everybody out there listening who isn't aware of this, it's not just to walk in one time and get an injection, okay?
No, sir.
You come to the office, you make a visit, you get assessed, you go through the entire team at Advanced Medical Solution, and after your injection, you continue to come back. So it's a group, you know, it's a group effort there. It's a lot of people working together with you closely, and there's a lot of things that take place just other than that injection. Agreed?
Yeah, I would have to say, and I'm going to brag in front of the doctor. I've been to a lot of doctors over the years because I was in hazardous work and we had to get physicals, and I was in oil and gas. And this doctor gave for $20 after dinner.
Okay.
You paid the $20, and my wife did. He gave me the most thorough exam for $20. He even discovered something on my back where muscles are more on my left side than my right. No doctor's ever told me that. And then he showed us the x-rays. I'm looking at my wife like, I got all this for $20. So that's another thing about his clinic. I mean, thorough exam. Gabby, I got to give her a shout out. Very professional, organized gal.
Yes.
Keeps all these guys in line.
Oh, she's so good. She's so good. We got a sharp team.
Yeah, you can feel the professionalism when you went in there. There's just, and they don't wear white coats if you're listening.
Actually, no white.
No white. It's all
no
black.
white coats in this office, son. Hey, thanks, Dave. Hey, Martin.
Yes, sir.
We were having a conversation, and you said maybe you went for a walk or a jog or something. We're talking about a week after your injection, and you said, hey, the bad knee's the good knee, and the good knee's the bad knee. Tell Fulton what you told me.
I'm telling you, like when my wife and I walk a good mile every morning,
Okay.
even with her bad knees and my bad left knee. And so we waited 3 days because Jeremy said, take it easy for the first 3 days. So we did, and so we were going to walk a quarter mile. So I'm walking, right? No braces. And my right knee is killing me, and my left knee is the bad one.
Yes.
And there's no twinge, there's nothing. I'm like, what did they put in here?
No pain whatsoever.
There's something more than stem cells.
Yes.
You know? And I'm telling
It's
everybody.
too good, isn't it?
Yeah, I tell everybody now, doctor, I think I got twins from the umbilical cord. I got like a double whammy.
You got
I got
the
boy
extra
twins.
dose.
That's
Yes.
a good one.
Yes.
Oh, that's hilarious.
Yeah.
So the same thing happened to me when I did my left knee. I did my left knee about more than 3 years ago now.
Wow. Great.
And as soon as I started back running, jogging, running,
Mhm.
the left knee almost felt like it wasn't even there.
It is a weird feeling.
It's a weird feeling. It's like it's not really there. It's strong.
That's a good analogy.
It's
That's
like
how
it's
mine
not-
feels
Yeah,
like.
especially compared to the right one, which was the good one. But it's almost like the right one definitely had some damage. I just didn't know it because of how bad the left one was. Left one gets fixed. Now the right one, it's just not right.
And you know what else? That goes to show you just how smart the brain is, because the overcompensation, you adjust as you go through your everyday life, and as we get older, the body continues to adjust to the things that are taking place, to the ailments that happen to us, and the brain is very aware of these and how we make those adjustments. So when you get that injection and you have such a dramatic change, you're able to identify just what the brain has been telling you for so long. So critical information there. That's really good.
The body is powerful.
The chiropractor Kerry has, I can't think of the name of the fellow that does
Dr.
it.
Holt.
Let me tell you, that guy is a magician. Because I used to drag race back in the early 70s.
Okay.
And I won't go on the radio and tell you what I did, but I got in a little accident. And my car, I had a Firebird. I hit this other car so hard, and it pulled my axles, my rear axle, off
Wow.
the car.
Wow.
And my left knee went into the emergency brake, and I had to wear a cast for a few weeks.
Mhm.
Well, doctor said this a couple of weeks ago when he looked at my spine, and he said, your hip's out of adjustment. Well, and I went to the chiropractor a few days ago with his chiropractor.
Yes.
I'm telling you, I don't know what he did to me, but I feel like my legs are the same length now.
Yes.
He said, your legs, and he was showing my bride, and he said, there's something, and
little length discrepancy there. So, and he pulled it right out.
He pulled it out.
And let's point something else out that's a very important fact that you're talking about here. Advanced Medical Solutions does a great job. Dr. Scott, Dr. Holt. When you go to get an adjustment, you need somebody who knows what they're doing.
Absolutely.
You don't need somebody who's new or fresh or does it part time. You need somebody who's doing it all day, every day, who's committed their life to this science, because it is a science. And you know what? Not only do I believe in it, I'm with you guys. I work in it, So when you believe in something strong enough, okay, you commit yourself.
There's a passion.
Absolutely. Absolutely. That's one of the things that brought Dr. Scott and I together. And every time, Martin, we speak with somebody like you, it just puts another point on the board for us, okay? And knowing that we're in the right area, we're doing the right work, and that it's making impact in people's lives. So congratulations.
I probably won't quote the doctor correctly, but another thing that caught my eye, he mentioned he goes to the Presbyterian Church, I believe, and I think he said, I'll paraphrase it, he wants to save lives, like most Christians want to.
Yes.
But he saves lives by helping them in their lives. Is that how you say it?
I say it all the time, but yeah. I mean,
and that's
saving lives.
Yeah,
saving lives.
He's actually saved. He's taking the pain out of their life. We're meeting people now, my brother's cousins. She's got a friend that lives down the street. They've been in pain for 15 years, and the doctors keep saying, suck it up. You're getting old. Too many candles on your cake.
Another prescription.
Yeah, another prescription. And 8 days, no pain in my knee. Like you said, it's literally like not there. It's kind of weird.
It's like it's not there.
Weird.
Amen.
It feels like stronger, or I forget how to explain it, but it just feels
not there.
It's like not there. It's weird.
Well, it's like Kevin told us a couple of weeks ago when he was asked. He said that he got his injection and left 85% of the pain right there in the office.
I like
okay.
that.
So check this out. This is what I was thinking about. You had the burning in the left side of the leg.
That's correct.
So what happens is when the knee's damaged, the song, the knee bones connect to the hip bone.
Yes.
You know how it goes. That part of that's why your hips were twisted as well. You see what I'm saying? Now, when you start getting that knee releasing and breaking up that scar tissue and out of pain, now you can take the chiropractor, Dr. Holt, do an adjustment on those hips, and it releases so much easier. And it'll stay.
Yes.
Because it's not pulling on a degenerated knee anymore.
Well, I go to a chiropractor, don't mention names, twice a month. Great chiropractor. But now that I met this chiropractor, there's a difference in fees because of my Medicare. I'm like one-stop shopping. I might as well go there. I'm going to make arrangements tomorrow morning. We got a meeting. And I'll go to his chiropractor twice a month because I guess when I got in this accident, my spine looks great all the way down. He'll tell you.
Pretty
but
straight.
The last one, that little disc is kind of spitting out. And the chiropractor in New York said, if you get that special table twice a month, it'll suck that disc back in and you'll be in good shape. So.
And one thing that goes to that, what Dr. Scott was just saying about the realignment, when you do the realignment, you also allow the blood and nutrition to get into those capillaries where it has not been for a while. You have atrophy taking place and the shrinking of, everything, the muscles, ligaments, tendons, everything. So when you put that nutrition back in there, it's just feeding fuel. And guess what's in that nutrition? Stem cells.
There you go.
Okay. So it could not be better food for the body.
It's amazing the stories, and I've only met Doctor a couple of weeks. The stories that I heard were people that either gone to him. A lady that lives down our street was a tennis player, and he knows who it is. I'll just say her first name is Ann. She couldn't play tennis. She's probably in her late 60s. Just had to quit. She met Dr. Scott. She waited the 3 months. Now she plays like a 30-year-old.
Oh, so she's already been through the process.
Oh, yeah.
You live down the street from her, and you weren't even aware of it until after you do your assessment and have your injection as well.
My wife went to some ladies' pool party, bunch of gals, and she met her, and they started talking. She goes, "You're going for stem cell? Oh, I'm going to tell you, Dr. Scott, blah, blah, blah." And my wife's going, "Yeah, we're going next week."
The word is getting out, Dr. Scott.
It is.
That's very cool.
He's going to have to get a bigger office. That's all there is to it.
That's awesome.
Yeah. It's getting out fast because people are tired of being lied to.
We sit in here all the time and talk about the current healthcare system, okay? What you deal with, what the doctors do, the discipline of the doctors. You go to an orthopedic surgeon, guess what he does for a living? he cuts, he replaces joints. So
Yep.
look what he's looking to do. That is the path he travels. So everybody out there, you have to think about yourself. You have to think about what you put in your body. You've got to think about what you do to your body. And if surgery is what you want to do, guess what? They're going to see you. But if you want to see an alternative path, if you want to see the new way of medicine, Dr. Scott at Advanced Medical Solutions definitely has the best understanding I've ever seen.
And it's not like brand new. It's been going on for decades over in the European countries and others.
Yeah.
They're just far ahead of us. Yeah.
Hey, we'll catch up with them.
That's right.
That's right. We'll catch up with them.
We're on their tails.
I met a guy at the pool the other day. I forgot to give him a call. Met a guy at the pool the other day.
Okay.
He just had a knee replacement on one leg,
Ouch.
on one side.
Wow.
He needs it on the other one. He said, I will not do it again. He said, I will not do it again. I will not do it again. And I didn't really know him, but I said, hey, I got something for you. There's an answer. He said, okay. We talked a little bit about it, but a lot of people that we help are people who've already had surgery on one side, and they will not, whether it's a shoulder, a hip, a wrist, an elbow. They've already had one surgery and they say, nah, I can't do it again.
Yes, absolutely not. You know, so many of them have, there are so many bad experiences out there during surgery, risk of infection. You know, when you do a joint replacement, especially the knee, one of the most important things is that you get that active range of motion. Okay, you're looking for 90 degrees. Okay, there are people out there that have these knee surgeries and their knees freeze up and they never get
Walk
any
ever properly again.
No, they walk with a limp, and that's just one of the many things that can go wrong with surgery. So there is, as we tell people out there every week, you do have an option. Should be your first alternative, not your last resort. This is what you should do first. Help avoid that surgery completely. And it's good to see the smile on your face, Martin, because I know you feel good about it.
Hey, check Martin out. Martin's
Yes.
pretty fit.
Yes.
Martin's pretty fit.
We go outside. We'll do a couple.
What do you do to stay in shape? Because you're in good shape,
I
my
worked
man.
heavy construction my whole life.
Okay.
Heavy construction. Quick story. I'll just say my youngest brother because I don't know if he'll want me to say his name.
Okay.
He's got stage 4 cancer called
sorry to hear.
non-lymphoma Hodgkin's. or something.
Non-Hodgkin's
It's a
lymphoma.
blood cancer, right?
Mhm.
They gave him 3 to 5 years to live. He's already been into the 2 years. They've given him all kinds of shots and everything.
Mhm.
I called him the other day from your office or something. He was crying on the phone. Sunday night I called him because I met Ann for the first time at a birthday party. And he was on the phone crying. And his wife, and they're both very well off. They're in oil and gas like I was, but they were right at the top. And I told him, I'm begging you, you got to go check out stem cell research. It could be an alternative for you, getting another 20 years of life. So he's definitely
That's
making
awesome.
calls, and he's going to check out. And Dr. Scott will help us find a doc. He lives in Houston, Texas.
Okay.
But imagine that if somebody told you got 3 to 5 years to live and you get these stem cells and boom. So
I've read papers.
Yes.
I've read papers.
It can happen.
Yes.
Yeah.
And it's coming. We know that we are so close. We've seen this industry advance so far since 2017 when it first opened up. Because you and I have this conversation all the time about the moratorium. We know that come November, that moratorium is supposed to end on this stem cell
Nice.
revolution.
Didn't know that.
But no, that's actually not a positive thing because it would slow down the progression. But what is happening is we're seeing so many positive results, like you are at Advanced Medical Solution, and so few negative impacts on patients who have had stem cell injections. So now it's just about understanding which source is going to work best for which disease state, which diagnosis, which patient, and it's just going to grow. So we don't see it slowing down anytime soon. We only see it speeding up, correct?
Yeah. And what they're going to do is they're just going to, as far as the moratorium and all go, they're just going to tighten up on some regulations, which
Yes.
might need to be done anyway to a certain
Absolutely.
degree. Because I've seen some places and some practices and some labs that you're just not interested in getting involved in.
Good.
So it's
Send out the
it'll tighten it up, but it's going to expand the industry in so much that we were just talking about it earlier. We partnered up with the FDA last year,
Yes.
nice.
and the most recent news that Fulton's just gotten, Fulton's in the research and development, is a Medicare approved systemic treatment,
Wow.
Yes.
breathing treatment with
Yes.
amniotic stem cell
Interesting.
treatment.
Yes.
Now, that is
Yep.
really,
Yes.
I have asthma, so.
You know what? Then that is
Give me an extra shot, Doc.
That's
you know
that
what?
clears. That's what it clears. And
It
it's
is.
actually a breathing treatment.
It's a breathing treatment, so it's through a nebulizer.
Wow, that's
and-
even more fantastic.
It's interesting.
And the conversation Dr. Scott and I had on the way over here was about doing the breathing treatment as well as the injection to your knee. It's a situation where 1 + 1 = more than 2.
Has a synergistic effect.
Yes.
Yeah.
Isn't that something?
Yes. Yes.
I believe you guys are on the cutting edge of something really great. And maybe it'll take off faster than the European countries. I don't know.
There are probably some economics and political aspects of it.
Sure.
But in reality, it's not. Really what it takes is people like us, people like you, the pioneers setting
Yep.
the stage, because really this is an individual choice for people.
True.
It's an individual choice for people. And it's something that anyone can do if they desire it. And ultimately what it takes is people having faith and trust and understanding the science, or worst case scenario, be so desperate to avoid a surgery to just try it out. And they'll realize it's really the new medicine. And it just takes individual people. I mean, if every person did it, think about it.
Yeah.
No one's going back to surgery unless it's an emergency situation.
I don't know if you mentioned this, and I hope I'm saying the right thing. When my wife and I applied for it, at the dinner, I think he said, Dr. Scott said 18 months financial assistance, interest-free. Well, we talked with Miss Gabby, and she set us up with a company. I figured, hey, I wanted to buy that sports car, And she
Yes.
goes, well, you can get, your credit allows you for 24 months interest-free. So we signed up,
Wow.
and Gabby got us the loan for no interest, but she got it in literally minutes. They came back on the computer. You got this for 6, and you got this for 5. It's a no-brainer. If you don't have the money, just get the 24-hour, 24-month
Yes.
loan.
Remember, I told
Yes.
you it was going to be effortless.
Yes.
It really
It's
was
effortless.
minutes.
We did it.
Yes.
Yeah,
It's
minutes.
effortless.
Gabby's good.
Yes.
She's
Effortless.
fast.
Good.
Yep.
Yes, she is. She
And
is.
she's very professional. I hope she's listening, because we've worked with a lot of people in my life, and so is my wife. She was methodical. I don't know if that's the right word. How she just took her time, and I didn't try to interrupt her, Doc. And she went, and then she called the people to make sure, and your company printed it all out in front of us, the contract, everything, like 3 minutes each person.
Wow.
Effortless.
Wow.
Effortless.
Gets a shot. So I was impressed with that. So anybody can afford this, even this young man over here in the camera.
Yes. It is a well-oiled system. I mean, it is.
His
It's not.
company is. I don't know
It's
about the
not
other
by
clinics,
accident.
but
It's not by accident. It's a lot of hard work. It's a lot of preparation.
teamwork.
It's a lot of, absolutely. There's so much teamwork that goes into it, especially with the patients. But on the backside, what the patients sometimes don't see, that Dr. Scott and I work on, is there's so much research going into this. The regulations that we work with the FDA, which is so critical to make sure we are staying abreast of everything in the market, and also what is best for the patients, because it's our job to identify when these things cross these thresholds and we're able to use them in the market. And we have more and more coming nonstop. We just don't know what's around the next corner. It's just groundbreaking how quick it is developing.
And it's like we said before, you got to know what you're doing. And so when we talk about, with the injections that you got, okay, Martin got stem cells in his knees. Wonderful. It's great. Incredible. What that team is doing on the back end, based on your examination, based on your x-rays, based on your body type, based on your symptoms, it's not just hey, just throw me one of those vials of stem cells. It doesn't work like that. There are multiple factors and different aspects of the stem cells and things that go along with it that they're using and analyzing as scientists, as doctors, of how much live cell do we need to go in there to regenerate? How much amniotic aspect do we need? What portion, what ratio do we need to decrease the inflammation versus what portion do we need for some scaffolding in the joint to make the joint
I like
stronger?
that word.
Yes.
So there are multiple things going on behind the scenes of actually, like you would imagine, going to a restaurant and they bring your plate out. Wow, fantastic meal. However, on the back end, you got these scientists, these cooks, these chefs, and we got these doctors and nurses putting these portions together based on how an individual person is presenting in the office on their symptoms, their x-rays, the ultrasounds that we use to look at it. There's a lot going on. And that's why the results are so phenomenal.
Exactly. We've talked many times about how when you go to the doctor, MD, he's in a box, okay? Once he sees your symptoms, once he diagnoses you, everybody thinks that doctor has choices. He has either or choices within a box, okay? He can't work outside of that box. So we don't start off in that box. We're going to identify up front what's going to be a more direct approach, because all a doctor does is write you a prescription.
Two things that impressed me about his clinic, Dr. Scott's. I'm a real anal guy. I'm real paper-oriented because of oil and gas. Got to mark everything down. Every time we were in a different room with him, they were always doing paperwork. They were watching him. They were asking questions. I'm like, nobody's ever asked me. And what was really unique, when Jeremy, that's the guy puts this gel on, I'm like, what are you going to do with this? He took a sonogram of my knee.
Yes.
I'm like, who does that stuff?
Yes.
And he was, he spent several minutes. He says, I want to get that needle in the right spot. I'm thinking, who does this? I've had a cortisone shot once. Doctor said, lay down, boom, gave me the shot. I don't know if he hit the right bone or what. Hurt like heck.
And Dr. Scott, I don't know that we've ever even mentioned that on the show.
No doubt. He's a sniper.
He is a sniper, that
He's
guy.
a sniper.
He takes his time, and I didn't feel the needle, so he did a fine job.
That's awesome. Some clinicians take the shotgun approach.
Oh, boy.
You can't.
They squirt a little each time they push. They get a little here, and then they get a little in this corner, and which the knee socket's probably your largest joint that you get to work in, and that one's a little easier than especially
like
when you
finger.
when you get or to the back,
and a deep hip,
and that one's probably one of the more challenging. Absolutely.
Deep hip.
It's harder.
Even a small person.
Even a small.
You got to go around deep. You got to go around deep behind the bone.
Yeah, these flexible needles.
I told him. I said the other day. I said, how you gonna get? I don't know. I'm not in. I said, how you gonna get in that hip? You gonna curve the needle?
Yes.
He said, that's exactly what I'm gonna do.
Wow. I've heard of chiropractors that have curved needles or whatever these doctors do. The needle will bend.
Yeah. Hey, they got techniques. It's all about a technique.
Yep.
Yeah, Jeremy Adams is curving needles.
Yeah, but that's the good thing about the ultrasound, okay, is because he knows exactly where he's at. You actually get to see where he's at, and you get to be part of the experience taking place. So you don't go home and question, did he get it in the right spot? Was it, what's taking place here? You know why it's working. You see it go in the right spot, and you feel it.
Well, I'll be honest now. I have white coat phobia, so fellas, my eyes were closed the whole time. He could have done anything to me, and I didn't watch. Even when they took my blood, I'm like tapping, and he's going, you're not even watching me. Yeah.
Hey, you did a great job. I'm proud of you.
Thank you, Martin.
Awesome.
Good time, fellas.
Hey, great time. I'm glad you're here, Fulton. Good to see you again, my man. Rick Roberts.
Yeah.
You're the man. Hey, bye, everybody.